So hi, I'm Gabby. I was a graduate in 2018. So I'm originally from Western Victoria. I was an undergraduate at Monash, and I did all of year 3 and 4 rurally in Gippsland. Year 3 I was based in Warragul, and year 4 I was based in South Gippsland in Leongatha. And currently, I'm actually not working rurally at the moment. I am in Frankston at Peninsula Health. I did my internship, but I'm currently one of the critical care HMOs there. I'm moving to Monash next year to do the anaesthetics senior resident job. Basically for the reason of anaesthetics jobs outside of Melbourne are quite hard to get as a junior. But with a plan of long-term training as much as I can rurally, and once fellowed, moving to a regional area and practicing there.
I'm Katie. I am an intern at Bendigo Health. I was a member of the extended rural cohort, so I trained in 3rd year in Bendigo, and then I spent half of 4th year in Maryborough in the Goldfields hub, and then the second half in Mildura. Then I did half of 5th year in Bendigo again, decided to come back to Bendigo for my internship. I'm actually from the city originally and sort of just got allocated ERC. It sort of converted me to a regional lifestyle, and I really love living out here. Actually just bought a house, so I've sort of committed to Bendigo now. I'm planning to stay here next year. I'm doing a general year with the hopes of working towards a career in O&G potentially. Then we've got Jess here as well.
So hi, I'm Jess. I was also part of the same ERC cohort as Katie. However, I was in different places to her. In 3rd year, I was in Mildura, which was the best placement ever. I thought in 3rd year, and still the highlight of medical school for me. Then in 4th year, I actually went home to Swan Hill. I'm from that region, so I returned to the Mallee for 6 months, and then did another 6 months in Bendigo. Yeah, a bit of a poster child there for Swan Hill. And in final year, I spent just over 6 months again in Bendigo, and now doing internship here in Bendigo as well. And I'm staying on next year to do a surgical year here, and we'll probably pursue surgery or ED at this stage. I really enjoy the Bendigo lifestyle, but in the future, I'll probably go to a small area long term. But so far, I'm really enjoying the training that I've had in Bendigo and Mildura.
Thank you, Katie and Jess. We've also got students who can talk to their experience. Students who've done 3B in the Southeast, we've got Megan Taylor, Marcus Pencer and Sam Robinson. In the Northwest, we've got Seamus Hinu. I'm sorry if I've pronounced your name incorrectly. We've also got 2 students who've done 3B in Metro, so you can ask them for comparisons. We've got Keisha Nash and Anna Zhang. Now, what we'd ask you to do if you have questions for any of our panellists is to please type them into the chat area. So while you're banging questions in there, we've also got some that were pre-submitted. Ashley, would you like to start with those?
This one is aimed at MRH. In the event that the Australian international travel ban extends to late 2021, does the university have a contingency plan regarding organising placement for international students unable to return to Melbourne due to extended border closures? Now, I don't think this is a rural question per se, and it can probably be directed actually at Med Student Services. So whoever answered that, maybe just send Jodie Vickers an email and she can help you out. I don't think it's an MRH question per se. So the next one, how cold does it get up in Bendigo and Mildura during winter? And will there be heating in the rooms and houses?
I can take a bit of that one. It can get pretty chilly up in Bendigo during the winter, but the heating, especially within the rooms, is fantastic. They're fitted with the best AC I've ever experienced. So it's actually pretty all right a lot of the time. As long as you rug up, you should be fine.
I would have to say the weather in Bendigo is better than Melbourne, and then Mildura's is even betterer than Bendigo. Mildura doesn't even really have a winter. It's got a couple of frosty days. And Bendigo, we always have blue skies. In fact, we've got blue skies right now. It's gorgeous. When it's cloudy in Melbourne, it's always sunny up here.
How does share house allocations work? And do you get any say in who you live with?
So I think you are able to email and put in preferences if you have someone you want to live with. Obviously, there's some limitations on flexibility, but Marcus will know more about the process he went through at Traralgon last year.
Yeah, so you again have like special consideration for like where you live, but assuming that's not the case, like you just get to send an email with just preferences that you want. So, you know, these my mates I would like to live with, or like just anything for any reason you're allowed to write, and they just do their best to accommodate for essentially whatever you ask for. There's no guarantees for getting your request, but at least here down in Gippsland, like Judy's in charge of that, and she's really nice and does her very best to accommodate, you know, everything that you would ask for. So the houses, there's normally about 4 of us living within a house. In 3B, there ends up being 2 of us living in a 4-person house, so that was quite luxurious for me. So where do you find out who to email? So there was on InPlace, I think it was, there's I'm not sure, this is recorded as well. I do not know who to email specifically. I only know that if it was Gippsland, probably Judy's the person. Does anyone know the site specific people for their regions or a way to refer them? I'll step back from answering this now.
Yeah, so it's Mark here from Head of School. You'll be contacted by your site person once your allocations are done. So basically it's an open communication channel with your site.
Just as a comment, as someone who did the share houses in Mildura and Bendigo and also Lister House, sometimes you don't get your preferences, or you just don't particularly have a preference because you don't know the people that you're moving to, specifically in some of the smaller sites, but you do grow and learn a lot from living with different people. And it's not always possible to get your first preference, and there is a lot of adaptation and I suppose learning how to live with other people. That's part of the adult, process, I suppose. And I think doing that is a really good learning curve personally for you as well. So they do their best, and it's a great opportunity. It's not always fun, but it's a great opportunity to learn about yourself and others.
Thanks for answering those, guys. We have another question relating to share housing. What has it been like living in a share house compared to Lister house accommodation, if someone's done both?
I spent 1.5 years in Lister and then basically 12 months in a shared house. I think Lister, for me, I'd never lived out of home before. Lister is a really good place to transition out of home. You're in a really well-supported environment surrounded by people that become your best friends by the end of the year. There's a large social component, and there's also the ability to you do have your own room, so you can step back if you need to. I think I also enjoyed the share house experience because then you do have a bit more of your own space, and especially I found in 4th year when I wanted to study a bit more, having a shared house, there's not as much social activity going on, and I didn't get as much fear of missing out when I was studying. But both experiences were really worthwhile, and I thought Lister was a really great transition out of home for those who haven't lived out of home before. And then I was back in Lister in 5th year as well, and for me, I think the social component is very enjoyable.
Cool, thanks guys. So the next question is, how does the workload compare to year A? And then what does a typical week/day look like on rural placement? So maybe I think Megan, I don't know who others have done year A. Want to jump in and answer that?
Yeah, no worries. So I think year A was probably more full on. I guess we had a lot of online content plus pretty full days of teaching. And I guess teaching can be quite exhausting when you're doing it for that long every day. So compared to that, I guess we had things broken up with placement as well as learning clinical skills, which I guess for me were less tiring, I guess. At Warragul, in terms of a typical week, we'd usually either have classes early in the morning, so maybe 8 a.m. Or in the afternoon, so maybe 5 or 6 p.m. You'd generally go to wards if you could, and for Warragul, every fortnight we'd usually travel to Traralgon for combined classes on things like path or ethics. So there was a bit of travel time involved, but Marcus might be able to talk to Traralgon, and Sam can talk to Sale.
With respect to Traralgon, a similar thing with most mornings being allocated to wards. Then I believe on Wednesday we had our problem-based learnings. So then we, during the first semester, we didn't have to travel much in Traralgon because everyone came to us for things like, I think it was the Tuesday pathology. But then in second semester, we had to travel to Warragul for occupational medicine. And that was maybe 4 or 5 events. But overall, in terms of total travel time, Traralgon is probably one of the least. Like you get to spend most just consistently at LRH.
Yeah, so in terms of travel time in Sale, like there's not too much, but it's probably not the best year to give a judgment of how much travel is required in like a normal year, because we started out maybe like once a fortnight, I think, going into Traralgon for ethics or med law, but it wasn't like, obviously once COVID sort of hit, we all locked down pretty hard. So I think it would maybe even be better if people that are, I don't know if there are some previous years that haven't had the COVID experience. It's certainly not, it's not too much travel, because, you know, you're normally carpooling with people, and, you know, max it's going to be like 40 minutes or half an hour, 40 minutes. And like, it's very much achievable. It's not something that I was like, oh gee, this is really impacting my, my studies or my like social life or anything like that.
As someone who did Gippsland in a non-COVID time some time ago, the travel's really not too bad. I think it was probably once a week we would drive from Warragul to Traralgon. Takes about half an hour or less if you're in a hurry. And you spend several hours there anyway. And me personally, like, I had a lot of friends that were placed there as well. So usually we'd catch up and go out for dinner afterwards or something. So it's really, really not too bad at all.
Thanks for that, guys. We do have another travel related question. At each of the sites, is it easy to get by without a car, or would you guys recommend bringing a car?
From my year, there was someone who didn't have a car in Traralgon, actually, not in Warragul, but I think they found it really difficult. The houses usually that you live in are not always walking distance from the hospital. So either you have to have housemates that are very reliable for carpooling, or basically your only other option really would be to get like a taxi or Uber or something, because you really can't walk. And especially when it's sort of finishing at later hours or quite early starts, you just have to, if you're going to walk, it's just going to take you like an hour. So they really struggled. So a car really vital, I think.
I can speak for Bendigo on this one as well. Bendigo's been unreal. So for the first semester, I didn't have a car. I got one in the mid-year holidays, and it's unreal. So to get here, it's about 2.5 hours on the train from Southern Cross Station. So, you know, it's almost faster than driving by the time you get to the traffic and so on. And yeah, up here, hospital, Coles, you know, office works, JB Hi-Fi, all within 20 minutes walk. And, you know, surgery in the early mornings, you can bike ride and it's less than 5 minutes to the hospital. It's unreal. So Bendigo was a completely different experience for me without a car.
I'm happy to talk about Sale. And yeah, it's been pretty good for us. I do have a car, but we've got about half of the students here don't have cars. And like, I think maybe if you don't have a car, it's good to have a bike, but like it's as fast to cycle to the hospital as it is to drive, if not a bit quicker. It's about 5 minutes. And that's from our house, which is the furthest from the hospital. Like the other two houses are sort of like within like about 1.5 Ks. So like it's pretty, like I think if you were going to pick a town to not have a car, I think Sale would be up there. Like obviously getting down to Sale on the train, like it's a bit of a pain. It's like probably 2.5, 3 hours. But like once you're here, you can navigate very easily without a car, if necessary, for sure.
So just on the bike riding chat, I just thought I'd weigh in a bit more on Traralgon. So in 3B, my roommate never had a car. I did. So a lot of the times he would ride. Like if you're happy to put up with like the rain, you can get by with the bike, but just be aware in Traralgon there's no bike lane. You'll have to do the emergency lane on the freeway, which I've done many times and feel safe about, but just thought you guys should know if you're making that decision. It takes roughly as long as Sam said to take your bike and drive in. Occasionally, just very rarely I would drive and my roommate would ride and would get there at similar times. So as far as time goes, it's not a big issue. We were moderate distance. There were closer houses than us. There were further houses than us.
Awesome, thanks guys. So now there's a question, if I live in the northwest of Melbourne, i.e. an hour away from hospital, should I move out to be closer to the hospital? This pretty much just depends on you. If you live in Metro and you go on Metro placement, you could be driving up to an hour to hospitals and moving between different clinical sites. So that's sort of dependent. And then obviously, as we've discussed, the hospitals are much closer to the accommodation when you're living rurally. There's another question about rent and how long are you required to rent for? Is it for 2 18-week semesters or is it over 40 weeks?
I think here in Lister, it's 40 weeks or 44 weeks. It's 10 installments spread out through the year. So I think, yeah, 10 installments of $440 roughly. And we're just getting to the end of that now.
Here in Gippsland, it's essentially pay for what you use. So if you go home for a couple of weeks during the break, Judy didn't charge us. If you decide to stay forward a couple extra weeks, or if you're coming like really close to the start of semester, it's very much paid for as you use. So Judy is quite good with that.
Amazing, thanks. Now we have another accommodation-based question. Are non-med friends and partners allowed to visit the accommodation, and are they allowed to stay overnight? This might be an MRH question.
That's a no.
No, okay, excellent. Okay, I think that's all the accommodation-based questions for the moment. I have one in the chat. Is it convenient for Gippsland-based students to return to Melbourne over the weekend? Do most people return, or does it get too busy with unexpected events?
So me personally, from Gippsland, I went home somewhere between every fortnight and every 4 weeks. I was in hillside, so that would have been somewhere between 3 and 4 hours each way. There were plenty of people who went back roughly on a weekly basis, and then a reasonable number who didn't as well. My experience was that it was better not to. You get to experience Gippsland a bit more. You get to catch up with people here a bit more. So you will be able to if you want to, but it's quite nice when you choose not to and stay down here for a bit. Just the total amount of time is not too much. If you're just thinking, you know, maybe 5 hours a week, it's not a huge time burden. You'll probably find it manageable. Unexpected events coming up wasn't a big problem for most people that I know of who traveled back regularly.
Yeah, I think I'd probably just second that. I think like it's definitely good to be aware that like you can get back if you need to. Like if you've got a partner or you've got like 21st or like you've got other events on, like it's very achievable to get back. That being said, as Marcus sort of alluded to, I think the people that probably enjoyed the placement the most are the people that like make sort of some attempt. It doesn't have to be every, you know, but some attempt to like get involved a bit in like a local community, like club or like organisation, because then you actually feel like you're sort of becoming a bit, as much as you can be, like a bit part of the community rather than just like your whole time in Sale being at the hospital, because like, you know, you're probably not going to have as great a sort of recollection of that time if it's all just spent at the hospital. But I think the other thing that is worth pointing out is like the train is a lifesaver. If you're worried about getting work done, like as I said, I had a car, but anytime I went back, I'd use the train because I'd just sit there for like 2 hours, 2.5 hours, and just like do work or like watch lectures, and you feel like you're being like quite productive on the way back to wherever you're going. So definitely, I think that's also a good like point to consider.
Cool, thanks everyone. So the next one is a question. I understand the demand for rural spots has been greater than supply in recent years. Can you give an indication of the likelihood of a non-ERC student who opts into rural being placed rurally? So Mark's made a comment that in third year there's 78 rural places, and of those 30 are ERC. So there's quite a lot more non-ERC students who will also be placed rurally. So I think if you do opt, high likelihood of being placed rurally. And then moving on to the next question. This is also probably an MRH question. Does your 3B preferencing affect your 4th and 5th year placements?
Okay, so when you're opting into rural, once you've been allocated to rural, you'll be given an option of whether you want to participate or stay in the rural school rural health for 2 years, so a 24-month option. So that gives you the option of staying in the same site or region in year 3 and year 4. So I guess in that sense, yes, it does affect your year 4 placement if you're opting that. You can always change your mind when you're going into year 4, but if you're wanting to sort of hedge your bets, if you like, and keep rural in year 4, then you can do that. Certainly doesn't affect you for year 5. It's a totally different scenario. So you're basically looking at rotations and specialties and those sorts of things. By the time you guys as year 3s get into year 5, I'm hoping that we go back to a normal that's not COVID, but who knows?
Thanks for that, Mark. There's also another question that you can probably answer, Mark. As ERC students are given priority for Bendigo and Mildura, does this mean the entire placement can be filled with ERC students? For example, if the maximum students from Mildura is 16, can all 16 be ERC?
Yes, conceptually, but there are special requirements in there as well. So Bendigo and Mildura are harder for non-ERC students to get into in year 3. That's not the case so much for year 4, but certainly for year 3 it is harder. Just by weight of numbers, because they can only go to that one spot, those 2 spots.
No worries.
Cool. We've had a question in the chat. Are there any differences between the teaching at Traralgon, Sale and Warragul? Also, it was mentioned that the rural 3B teaching is run differently from Metro. What exactly does this mean? So maybe we'll have someone from Metro just talk about their teaching. I think I've seen Keisha's here.
Yep. So my teaching at Frankston, we would just have lectures on a Wednesday, and that would include our PBLs and our pathology teaching. And then we wouldn't often have classes on the other days, but you would get the odd class. We did have a little less teaching compared to other metro sites at Frankston, but we all passed. So.
And then does someone from rural want to just comment on the differences?
I think there's also Anna, she was placed at MMC.
Yeah, so I was at Dandy MMC last year for 3B, and we had a bit more teaching, I think. It also varies between sites, so I think Eastern may be a bit different as well. So we would have Wednesday dedicated to teaching. The morning would be about kind of, it'd be specialties, so cardio, resp, GIT, whatever you're going through. And then the afternoons were usually taken up by things like OCMED or EBCP. And then on Tuesday afternoons, we had pathology as well as our PBLs. So the rest of the time, it'd be like up to you. You can go to the wards, or you also may have some surgical bedside tutorials or and clinical bedside tutorials as well, depending on your site. And that'll be during your clinical placement time.
So in terms of the different teaching across Gippsland, so I was a 3B last year in Warragul. Warragul probably had the most teaching out of the sites, and it was probably a gradient from Traralgon to Sale in terms of teaching. We got teaching both from local clinicians, as well as getting a lot of the teaching from Traralgon over video conference, and having more face-to-face teaching with the Traralgon students around things like med law, ethics, EBCP, pathology as well. So we probably had teaching most days. Monday was mostly teaching, and then every fortnight on Tuesday was Traralgon-based, full day of teaching, and then it was either in the mornings or afternoons on the other days.
Thanks for that, Megan. Did someone want to talk about how teaching happens in Bendigo and Mildura for Verticus?
I can speak to Bendigo. So yeah, a lot of our lectures have been moved online. We have lectures on Monday and Wednesday, and then we have like a PBL sort of thing on Thursdays. And we have a lot of sort of student run teaching. So on Friday, we'll have a seminar where groups of students will get together and present on a topic. And we have a consultant from the hospital looking over and sort of giving their insights. And they're often on certain matrix conditions, so they're quite high yield. However, a lot of the other teaching is sort of just done in small groups, about 9 to 10 students with a senior doctor on certain specialty areas. So things like surgical oncology, endocrinology, that sort of thing. Yeah, but I think it's been pretty good. I'm not sure what it's like in Mildura.
Another element of teaching here in Bendigo that I'd like to touch on as well is the practical teaching, which in my experience at least has been incredible. So we have a really good team of clinical skills educators up here. And you've got all the latest technology with your dummies and stuff that all speak, but it's when you get into the hospital, we have these things called ward visits. So you get one every couple of weeks, and you get an hour dedicated with a nurse to just do activities. So it's gotten to the point where everyone up here can do a venipuncture or cannula with their eyes closed, and it's just unreal. Like, the experience you get is so good. And it's gotten to the point, I think it's a COVID thing rather than an actual Bendigo thing, but at this point we're also having sort of experiences like that in the ED as well, where they'll bring students in if they would need cannulas done. And it's just stuff like that that's a brilliant. Like there's so many opportunities that's like teaching because it's on your timetable, but in reality, you can just do whatever you want for the hour and, you know, it all contributes to your logbook.
Well, maybe you can teach me how to do a cannula with my eyes closed. I just want to say from an intern perspective, I, as a third year and then as a fourth year, spent a lot of time stressing about missed education opportunities. I always felt like there was more happening in the city. And I think in hindsight, they may have had more hours of lectures, but as Tom touched on, that doesn't really translate to sort of on the ground experience. I don't feel that I'm any worse off than any of my intern colleagues who did metro training in terms of my knowledge. And I do feel like I got a lot of good practical experience that prepared me well for internship. So I think throughout the next couple of years, you'll always feel like you're missing out. But just be reassured that the programs in rural Victoria are set up by the School of Rural Health to be very strong, and they've proved that in their results over and over again. So that they do know how to teach people in the rural areas. And yes, it's different to the city, but just try and take the best out of that.
I think just going on from what Katie said, the smaller cohort sizes as well as at most rural sites just gives you much more sort of one-on-one time, less competition for things. So I personally, probably not as an intern so much, I think, but definitely going into final year especially, I felt from a sort of procedural point of view, like cannulation, venipuncture, suturing, initially I felt like I was maybe even a little bit ahead of my metro colleagues just because I'd had opportunities to do that much more than they had, because there was never more than sort of 10 people in the cohorts in Gippsland that I sort of had to compete for opportunities to practice.
Thanks for that, everyone. So I have a question here about kind of the experiences of placement this year. It's in regards to COVID. So I'm just going to speak very quickly on the third year's metro placements this year, because I've been mentors of a couple of groups. So this year in metro placements, third years have mostly been off placement the entire year. There's been months where they haven't been allowed to come in at all, and they've only just started being allowed to come in and only seeing patients that their fifth years have found them. This is obviously different. I'm at Monash at the moment, but this is different at other metro sites. But at Monash, they can only see patients that we have found them and then they leave. However, in rural, from my understanding, it's been relatively normal for our third years. So I'll get Seamus and Tom to speak on their experiences this year in COVID.
Yeah, from my end, there's been almost no change at all. Going home at Easter, so Seamus and I are really good mates, and we set up here together for Easter. A few kids did go home, and then the hospital decided they would need to quarantine when they came back. So there was 2 weeks where some of the cohort who had gone home had to hang around, but that's purely a COVID thing. Apart from that, so that's purely because the risk was increasing. But apart from that, we've had no problems at all. So everything's been business as usual.
Yeah, I found that we've been able to go in most mornings, been able to go chat to patients and all that, and even just helping out the team. It's been really fantastic. And yeah, as it's been alluded to, the smaller sizes of the teams is really helpful in just sort of getting to be a bit more involved. And I've really cherished that. And I think it's put me in good stead for years coming ahead.
Excellent. Thanks, guys. What we might do is we might get you guys just to talk about what your kind of placement looks like and what you do on a day-to-day basis, just so people get an idea of what you do when you go in. We've only got a handful of questions left, but I think it might be a good idea to actually get some of your experiences in placements.
Cool, I can kick it off. So basically, it depends what team you're on, but a lot of the time you'll go in, it depends. If you're on surgery, often have a bit of an earlier start around 7 o'clock. Whereas if you're on sort of medical, it might be around 8. And then I even had on rehab, we had 9 o'clock starts, which were really nice. You often do ward rounds. So you go around with the team and just have a quick assessment of each of the patients. And once that's done, it's a bit freeform, I guess. So you can either help out your interns with certain ward jobs, or you can go off by yourself. And I know a lot of students have done this, just go on to particular patients they've seen on the ward round and practice taking histories or doing exams. And that's always really valuable, especially because you sort of know what they have. So it can really lead you in the direction of what you're looking for. And Tom talked before about the ward visits. So we'll have a nurse come along and sort of supervise us as we do cannulas, venipunctures, all that sort of thing. And that really helps you get your logbook ticked off.
In terms of sort of home time after hospital as well, one thing, so I'm at Lister House, which is the dorm setup. And one thing is the fifth years live just over there. Like I can see them out my window. And so, you know, you have dinner with them at night, you talk about questions, they do tutes and stuff with you. And I think just being around students all the time helps so much as well. Because I sort of struggled in pre-clin, just in terms of learning everything. There's a lot of content stuff. And year 3B is quite the same, but it's just being surrounded by people that's unreal. And I think that's a big thing that you don't see on the brochures is like, yeah, the hospital experience and all of that. But as soon as you get home, you're surrounded by people think the same way as you, and you go over, you know, there's a tute at the moment happening as well in the common room. It's just really good stuff. Like there's so much sort of student, like self-directed learning outside of the hospital. That's also really fantastic.
So you guys have asked for like, what does a typical week look like? I might put on screen share if that's all right, because I've got the timetable and you can just see what the typical week looks like. So this is 3B. I just got a random week. So can you guys see the paint document? Like you just depending on which ward you're, what thing you're in, like you start wards, some are 7:30, some are 8:30, depending on whether you're in like surgery or general medicine. Case studies, everyone gets together for 2 hours and talks about some cases. Bedside tutes, you have a local consultant normally come and teach you for an hour. They just take you to a patient that they think is interested in, is a good learning point. Wards again, pharmacology, I think we had that once a fortnight. Pathology standardized for everyone. I think that was every Tuesday. Wednesdays are those PBLs and then the PBL quiz. Bedside tutes, this was not a regular thing. A radiology, we had them once a fortnight. Us students occasionally took one at a time to go and do respiratory stuff. EBCP, evidence-based medicine, we had that I think about once a fortnight as well. So it just gives you an idea of what's going on, and you can always go to the wards, but classes take preference, and you have the option to go to wards every day. You should try to go about 3 days a week, sort of thing you're looking at. Just thought timetable might be good to get an idea of what a typical week looks like.
Awesome. Thanks so much for that, guys. So wrapping things up now, just comment on one of the questions. So it was about the disadvantages of going rural and not seeing as many specialties or interesting cases. Just probably on this, I think everyone gets a varied experience wherever they are and what time of day they're in at the hospital and which day they're in each week. So I don't think you can really say that less specialties rurals compared to metro, because everyone comes out of clinical placement with a totally different set of cases that they've seen. And then one more question, someone asked, is there any difference between, or what are the experiences difference between being rural in third year versus being rural in fourth year? So there's someone who's done both.
Yeah, I guess I can speak to that. It was a few years ago now, and I know the model's slightly different. Just going back to the previous question about the not as much specialty exposure, though, I just wanted to touch on that too. I think people get really caught up about all this specialty med, but in your first year of clinical placement especially, you need to have a good base knowledge of medicine generally. So working on general medical wards that have patients that would otherwise be sort of allocated to specialty teams is actually, I think, a better foundation to build on, and then you can do those specialties sort of in final year or once you start working. If you miss that though, I think it's a little bit harder to just get that general overview to build on. so the model was different for me than it is now, but third year you're really placed at one site, but fourth year there's a lot more movement. It's obviously a lot more specialty as well. I don't think there's a great deal of difference from the experience. I think a lot of people stay on, so a lot of people that you will know and have built friendships with in third year, you are very likely to have in fourth year on placement with you as well, which I think is a nice thing. You have that support network already in place. But I don't think there's a great deal of difference. Some people do one of each, some people do both in rural. I don't think it makes a great deal of difference.
I think for everybody, fourth year is a more challenging year. And so it's difficult to compare them in that way, because I found third year a really fun year. You've just moved out of home. For me, you're in the hospital for the first time. Whereas fourth year, there is more challenging academic demands, and I'm not sure, it may have changed for your cohorts now that there are less sort of demands on assessment, but I did find fourth year a harder year, but that wasn't necessarily because of the rural experience. I think that was just overall a harder year, and you're seeing a different sector of healthcare. Essentially, I found that the fourth year rotations are a lot more specific, whereas third year you're just taking everything you can and just getting used to the hospital environment.